my name is Dr. Sannisha Dale. I am a clinical psychologist by training. So I come to the health psychology sphere with that clinical work in mind. Strong focus on trauma, PTSD, helping people heal after experiencing losses and trauma. My work really centers here at the University of Miami. I'm an associate professor in psychology, but I do a lot of work across campus. And my work really centers around HIV prevention and treatment as well, but taking it from a psychosocial lens in terms of thinking about how factors such as structural factors, isms, right? Racism, HIV, stigma and discrimination that people face, LGBTQ related discrimination, but thinking about what are the issues that actually resulted in a higher prevalence of HIV among communities that we see the highest burden for HIV. It's not behavior. So if there any kind of confusion around that, it's not driven by behavior. It's an epidemic similar to COVID that's driven by structural factors and isms. And so I tend to do a lot of that in my work in terms of thinking about experiences of discrimination, thinking about neighborhood factors. I do both qual and quantitative work, so a lot of mixed methods work. And I do a lot of community engagement work in terms of centering community voices to really allow us to do the best work that we can. I also have my hand in different approaches across campus. So I am an MPI for a T32 called Change. And it's really a T32 that's geared towards providing funding and deliberate training for individuals who are committed in their career long-term to develop research, and also that have high impact for communities, specifically Black, Latinx, and LGBTQ communities that are highly impacted by HIV. So I run that training program for trainees along with my other two MPIs. I'm also the director for our mental health disparities core for our Center for HIV and Research in Mental Health. And I forgot to mention my own lab, but I run the SHINE research program of students, postdocs, community consultants, and core team members where we do a lot of this research and carry out the work.